Okay, good morning and welcome back to Office Hours with Dr. Ellen Derrick. I am triple board certified physician. I'm board certified in general surgery, vascular surgery, and also in obesity medicine. And today we're going to talk about high blood pressure. Standard blood pressure is 120 millimeters of mercury over 80 millimeters of mercury. And you'll see it in your chart as 120 over 80. That's the ideal that we talk about. And blood pressure is a reflection. So, as a vascular surgeon, I'm really just a plumber. And I think about pipes. If my heart is going to pump blood and deliver it all over my body, it's going to deliver it, north against gravity to my head, and it has to deliver it all the way down to my toe immediately so I can run and walk. There has to be an artery system that is under pressure so that, we can have small pipes with a lot of very fast, frequent flow. So there's a standard pressure where all of our processes in the capillary can function effectively because it turns out the capillary is the boss and all roads lead to the capillary, arterial, lymphatic, and venous. And so it needs to be under pressure so it can be delivered quickly. And so 120 millimeters over 80 millimeters of mercury is about standard. And that means with each heartbeat, all of the tissue is going to be perfused evenly and easily with oxygen and nutrients, and the veins and the lymphatics will also be able to take the fluid and the leftover blood and return it where it needs to be. Okay, so what causes high blood pressure? I mean, there's about a million things that can cause high blood pressure. It can be familial and run in families. Patients with, if you think about the artery as the pipe that holds the high pressure, the artery has a muscle inside of it. And so it allows the pulse wave. When your heart beats, there's a pulse wave that's created. It's PQRS. You can see it on an EKG. When the pulse wave is propagated, the muscle allows that pulsation to propagate. But there are certain disease processes that stiffen the artery. And so the artery can no longer relax or tighten depending on how much volume of blood it has to deliver where it needs to be. And when arteries stiffen, then the pressure becomes higher. The pressure, the law of Laplace, and I won't get too much into physics today, but there is a reason you study this as pre-med. It has a lot to do with the physiology of the heart. However, one of the reasons can be stiffening of the artery, and you end up with high blood pressure. So, noticeable symptoms and warning signs of high blood pressure. So, headache is one, ringing in the ear is one, swelling in the lower extremities is one. And we can talk about arterioles and the capillary and the veins and the lymphatic system. I love talking about that. Yes, it can also be silent. You can have high blood pressure and not even know about it until you go to the doctor and you have, a very elevated blood pressure or just a little bit elevated blood pressure. So yes, it can be silent and it can also be symptomatic. Okay, so if you don't know that you have high blood pressure, so if you're pregnant, you can lose your baby and you can hemorrhage and you can develop a lot of problems. You can also have a stroke. As we get older, the capillaries and small arteries in our brain are more fragile. And so if they're exposed to high pressure, they can just bleed and you can die or have a terrible neurologic consequence. If you have an aneurysm, which we've talked about on previous office hours, if you have an aneurysm somewhere, the elevated pressure can make it pop, just like if you're filling the water balloon in the sink and your brother comes along and increases the water pressure, suddenly the water balloon can explode in your face. That has happened at our house. An aneurysm can explode. You can damage the lining of the artery over time, and that creates a buildup called atherosclerosis. illness that then later down the road can develop heart disease and also amputation in the legs. High blood pressure over time can damage the eyes. That high pressure, the little baby arteries can't downregulate it easily, and patients can lose their vision. Patients can also lose their kidney function over time with high blood pressure. There's a lot, just think about it. Let's think about a car. A car's on the highway. I live in Seattle, so it's I-5, and I'm cruising along at 65 miles an hour, and I see a slowdown up ahead. Well, I have time. I can reduce my speed. I can brake so that I don't slam into the cars that are stopped in front of me. But when there is elevated blood pressure in the artery system, it means it's unable to slow down. And so that high velocity pressure is going to directly impact the tissue that it feeds. And that's where you get the damage. So in an ideal way, in a car, I can slow down. I have time. But in my body, if my blood pressure was really high, it would injure the kidney. It would injure the brain. It would injure the eyesight. So that's a simple story to explain a physiologic fact. So people maintain healthy blood pressure by exercise, by moving your body. 30 minutes of walking 6 days a week. You don't have to run a marathon. You don't have to be fast. You don't have to do it all at once. But 30 minutes, 6 days a week helps the arteries maintain their ability to relax. So that's very valuable. It's like a muscle. You've got to use it. Eating non-processed foods, also very valuable. High sugar, high salt can cause an increase in blood volume, which can transmit to an increase in blood pressure. So having a whole foods nutrition plan and not a processed food or high salt nutrition plan is very valuable. And stress, actually. So, when I was growing up, they called it the type A personality was the one with all the high blood pressure. And my grandfather wrote one of the first papers on cholesterol. He was a surgeon in Texas, and he himself had a lot of heart disease. And so in the 50s, the thinking was, well, goodness, my grandfather is obviously type A, so he's under a lot of stress. He had 6 children and a very busy surgical practice. He was also the chief of surgery at his hospital, so he's a very busy man. And he had a heart attack, and they thought, well, gee, and he also had high blood pressure. And the thinking was, it's just stress. So that's a story for another day, but stress reduction became a real thing in my grandfather's house. And he thought, as a scientist, he thought, well, there's probably something more to it than stress, although stress is important. And he thought there might be a molecule, and he didn't know that molecule would be cholesterol, but his hypothesis was that the stress somehow activated a physiologic process in the body, and there must be a molecular connection to that. And it turns out it's cholesterol. That's the word for what he was thinking. But stress drives stress hormones, which cause our arteries to constrict and get tighter because they think that the tiger is coming and we need immediate oxygen artery delivery so we can run away and survive. So, depending on why a patient has high blood pressure and depending on how high it is, your physician can work with you to take a medication, to do what we call lifestyle modification. Maybe it's focusing on nutrition balance, focusing on stress, focusing on exercise. It may be stopping smoking. Smoking is one of the drivers. It's difficult to quit. The average time to quitting is 15 attempts. It's a very difficult behavior to change. However, stopping smoking will definitely lower your blood pressure. It changes with age. So I think the standard recommendation, if you do not have high blood pressure or other diseases, is once a year to check it with your doctor. And it could be a little higher. You can certainly check it yourself with a blood pressure cuff, but just be warned that those ones that they sell at Walgreens or on Amazon are not perfectly accurate. So if you get a high reading, it's important to make an appointment with your physician so you can have, a formal reading done to make sure that it is truly high. So thank you so much for joining me today. And I hope that you join me for further episodes where we explore themes around arteries, cardiovascular health, and venous disease.